So the prognosis of patients with relapsed diffuse large B-cell lymphoma who are not eligible for autologous transplantation is very poor. And the studies focused on these poor prognosis patients report a median progression-free survival of 6 months, and more than 80% of these patients died of lymphoma, usually within the first year of follow-up. Then a long-lasting maintenance with an oral drug may be a good strategy to prolong the duration of response in these patients. Lenalidomide, an oral immunomodulator, is a suitable candidate for this strategy, since it's active against diffuse large B-cell lymphoma, and it can be taken for years with an acceptable safety profile. Then we designed and executed a phase 2 trial focused on the feasibility and efficacy of lenalidomide maintenance in patients with relapsed diffuse large B-cell lymphomas who are not eligible for autologous transplantation or who experienced the relapse after autologous transplantation. We registered 46 patients in this trial. Most of these patients were elderly patients who were not eligible for autologous transplantation, and other patients refused autologous transplantation. Others were not experienced relapse after a prior autologous transplantation. The median age of the study population was 72 years old, and there had important unfavorable features. In particular, most of the patients had advanced disease with extranodal involvement, poor performance status, and high international prognostic index score. 12 patients had a concomitant hepatitis C virus or hepatitis B virus infection, and 6 patients were relapsed after prior autologous transplantations. The overall results support the use of lenalidomide maintenance in these patients. The primary endpoint was largely achieved, with 28 patients who were relapse-free at 1 year of follow-up, with a median progression-free survival of 3 years, which is an impressive result for these poor prognostic patients. Half of the treated patients had a duration of response to lenalidomide which was longer with respect to the prior response to the prior treatment line, which is an unusual feature in diffuse large B-cell lymphomas. And then the survival of these patients is close to 60% at 4 years, which is an impressive result with respect to the related literature. In conclusion, this trial support the use of lenalidomide maintenance in patients with relapsed diffuse large B-cell lymphomas who are not eligible for autologous transplantations. And the strength points of the trial are that the response to lenalidomide is longer with respect to the duration of response to the prior treatment line in half of patients, is twice as long in 1/3 of these patients. The patient with PET-positive residual disease after salvage treatment has a progression-free survival longer than 25 months, which is another uncommon feature in diffuse large B-cell lymphomas. And this treatment was well tolerated in an elderly population. The results were equally encouraging, both in de novo and transformed diffuse large B-cell lymphomas. Importantly, the drug seems to overcome the negative effect of activated genotype in this setting, and obviously these data support further investigation on the role of immunomodulators, drugs in maintenance in high-risk patients with relapsed diffuse large B-cell lymphomas.